Hello and welcome. Today we're diving into a critical topic that affects millions of people worldwide, hypertension, or more commonly known as high blood pressure. It's often called the silent killer because in many cases it shows no symptoms. But don't be fooled. If left untreated, it can lead to serious health problems like heart disease, stroke, and kidney damage. So, let's break it down together. First, what exactly is hypertension? Blood pressure is the force of blood pushing against the walls of your arteries as your heart pumps blood. Hypertension occurs when this force is consistently too high. Over time, this extra pressure damages your arteries and other organs. Blood pressure is measured in millimeters of mercury, mmHg, and recorded as two numbers. The first number is called systolic pressure, which represents the pressure in your arteries when your heart beats. The second number, called diastolic pressure, measures the pressure in your arteries between beats when your heart is resting. A normal blood pressure reading is typically around 120/80 mmHg. Elevated blood pressure is when the systolic number is between 120 and 129, but the diastolic is less than 80. When your blood pressure consistently reaches 130/80 mmHg or higher, that's when we classify it as hypertension. There are two stages of hypertension. Stage 1, hypertension, systolic between 130 and 139, or diastolic between 80 and 89. Stage 2, hypertension, systolic of 140 or higher, or diastolic of 90 or higher. If your blood pressure reaches 180, 120 mmHg or higher, that's called a hypertensive crisis, and you need immediate medical attention. Now, here's why hypertension is so dangerous. It's often symptomless, especially in the early stages. That's why it's called the silent killer. Some people might experience headaches, dizziness, or nosebleeds, but most feel perfectly fine until serious damage has been done.